I ask consent that the senator from Arizona and I be permitted to engage in a colloquy for up to 20 minutes.
Without objection, supported.
Would you please let me know when a minute is left?
Chair will do so.
Mr. President, I heard the majority leader talk about denying care, and that's the issue before us, one of the major issues. The vision of Republicans is that there won't be someone in between a patient and a doctor who would get in the way of the treatment that you need or the care that you need, or have you stand in line or wait too long. And our great fear is that the Democratic proposals so far, which we've not really had a chance to participate, would put the government in between you and your doctor, and the government doing the rationing. Republican proposals such as those of Senator Gregg and Senator Burr and Senator Coburn, and even the bipartisan proposal by Senator Wyden, a Democrat, Senator Bennett, a Republican, which I'm a co-sponsor of, all envision a system where those of us, the 250 million of us who already have health care insurance, would be permitted to keep it, and that we would find a way to reform the tax code to give to individuals who don't have good health care the money they need to buy the health care and to choose it for themselves. Our concern is that the government might become too much involved, and that we might create a program that's so filled with more debt on top of the debt we already have that our children and grandchildren simply couldn't afford it. Senator McCain, the senator from Arizona, has been, I guess, in more town meetings about health care than any other American, at least any other American who serves today in the United States Senate. He was in Texas last week and home last week in Phoenix, some of our leading institutions, to hear what people had to say about it. And I wonder if I could ask the senator from Arizona if he heard concern from those in his home state of Arizona or those at MD Anderson in Texas about the government getting in between the patient and the doctor.
Could I say, first of all, thank you. I'd like to thank the senator from Tennessee for his leadership on this issue. It's a privilege to serve on the Help Committee with him, and his continued involvement in the ongoing discussion and debate about 1/6 of America's gross national product has been vital. And I thank my friend from Tennessee. And could I also pick up on what you were just saying, that the majority leader criticized the Republican leader in the House who said America has the best health care system in the world. What the Republican leader in the House was saying was the obvious. America has the highest quality health care in the world. And as the senator from Tennessee just mentioned, I was in Houston at MD Anderson with Republican leader, Senator from Kentucky and Senator Cornyn of Texas, and there were people there from 90 countries around the world, 90 countries, most of them wealthy people who could have gone anywhere in the world for health care, but they went to the best place in the world, MD Anderson, or one of the best. I would argue we have some facilities in Arizona and probably in Tennessee that are of equal quality. But is there any doubt when people come from all over the world to the United States of America that the highest quality health care isn't here in America? It is. The problem is, and I'm afraid some of my colleagues don't get it, it's not the quality of health care, it's the affordability and availability of health care. And our effort has been to try to make health care affordable and available. The latest proposal of the Democrats is that it only covers, their latest proposal only covers 40% of the uninsured and costs trillions of dollars. So why not, I would ask my friend from Tennessee, why not let people go across state lines to get the insurance policy that they want? Why couldn't the citizen of Arizona who doesn't like the insurance policies that are available there find one in Tennessee? Why not have meaningful malpractice reform? We all know where 10, 15, 20% sometimes of healthcare costs come from. They come from the practice of defensive medicine. I mean, everybody knows it. It's the elephant, it's one of the elephants in the room. And so therefore, we do not have, and consistently in the Help Committee, amendments that has been proposed by the senator from Tennessee and me and others to reform medical malpractice have been voted down. The state of California, some years ago, enacted meaningful and significant medical malpractice reform, and guess what? It has decreased health care costs. So we're not getting, I say to my friend from Tennessee, and I hope he agrees, that we're going at the wrong problem. The problem is not the quality of health care. We want to keep the quality of health care. It's the cost and affordability of health care. And we have not yet gotten affordable and available health care for all Americans.
If I could ask I completely agree with my friend from Arizona. I think of the pregnant women in rural counties in Tennessee who have to drive all the way to Memphis, all the way to Nashville to get prenatal health care because there are no OBGYN doctors. All their medical malpractice cases have driven up their insurance, and so there's no way for them to get health care. And I listened to the majority leader talk about the tragic case in Nevada of someone unable to get health care because of a pre-existing condition. If I'm not mistaken, and the senator from Arizona knows all the proposals, I believe all the Republican proposals would say that everyone would be covered, that pre-existing conditions would not disqualify you. The issue before us is whether we're going to add trillions to the debt or put the government in between the patient and the doctor.
I totally agree. And could I mention, since the Senator from Tennessee and I are going up to another meeting of the Help Committee, the roll call article this morning says, and I quote, Senate Majority Leader Harry Reid on Tuesday strongly urged Finance Committee Max Baucus to drop a proposal to tax health benefits and stop chasing Republican votes on a massive health care reform bill. Reid, whose leadership is considered crucial if President Obama is to deliver on his promise of enacting health care reform this year, offered the directive to Baucus through an intermediary after consulting with Senate Democratic leaders during Tuesday morning's regularly scheduled meeting. So, in other words, according to this article, any shred or semblance of bipartisanship is now out the window. So, I think the senator from Tennessee would agree with me. One of the very disappointing aspects of this whole debate is we really haven't changed the climate in Washington. Has there ever been, to the senator's knowledge, a call to sit down at a table in a room with leading Republicans and Democrats and say, hey, can't we work this out? What is your proposal? Here's ours. Can't we sit down and agree to save health care in America and preserve its quality and make it affordable and available? The same way back in the 1980s when Ronald Reagan and Tip O'Neill sat down together and they saved Social Security. So
the senator from Arizona,
this is really unfortunate that even the last shred of attempts at bipartisanship is now gone. And now maybe it's because the 60th Democrat vote was sworn in yesterday. Maybe they figured they have the votes, but it's not, and maybe they do, but it's anybody who alleges that this administration and on the other side of the aisle is changing the climate in Washington, that is simply false. And it's
probably no one in the Senate, if I may say, who more times than the senator from Arizona has been in the midst of bipartisan negotiations. It's not just for the purpose of feeling good. It's the way to actually get broad base of support for an energy bill or an immigration bill or Supreme Court nominee. And usually it involves, if I'm not mistaken, sitting down with several members of each side, coming to a consensus, really sharing ideas, and then fighting off the left and fighting off the right and producing 60 or 70 votes. That's the way we really do bipartisan bills around here, if I'm not mistaken.
Well, I just said to my friend, indeed. And one of the issues that I think we really ought to continue to understand is one of the key elements of this debate is whether we will have the so-called government option. And I know the senator from Tennessee is going to talk about that. And I think it's important for us to look overseas at other countries that are highly industrialized, highly sophisticated, strong economies, countries that have adopted government-run health care. And to say that a government option would be just another competitor clearly is not the case. Otherwise, we would just have 1,501 new insurance companies in America. If you have the government option, it will lead to government takeover of health care, and we ought to look at what other countries do. And I'm sure the senator from Tennessee knows that, but it is health care rationing and a level of health care that would not be acceptable in the United States of America. And I say that with great respect to our friends in Canada, the British, and other countries that have government-run health care systems. So that I think is going to be one of the two major issues, the government-run health care and the employer mandate. Those is what this health care debate will really come down to, and it's of great concern. I know it is to the senator from Tennessee.
I thank the senator for Arizona, and I know that he's on his way to work on the health care bill, to take the leadership to the extent we can in making it a better bill. I thank him for coming to the floor to discuss that today and to help us reemphasize that we don't have any disagreement with our friends on the other side about the need to reform health care. I don't think we have any disagreement. At least we want to make sure that our principal goal is to make it affordable for every American. We want your family and you to be able to buy health insurance at a price you can afford, and to take care of tragic cases such as the one the majority leader talked about. I think there is a consensus on both sides of the aisle to make sure that if you have a pre-existing condition, you can be insured, and it won't matter where you live. And the proposal, the Wyden-Bennett proposal, for example, and others as well, also say that you may carry your insurance from one job to the other, so that if you lose your job or if you change your job, you still have your insurance because it's your insurance. It doesn't just depend upon your employer. What we are concerned about is the fact that President Obama's administration has already proposed to add, over the next 10 years, more debt, more new debt, than the three times as much new debt, actually, as this country spent in all of World War II in today's dollars. That's the first thing. And the second thing is this idea of the so-called government option. The government, someone says, well, what's so bad about that? Well, think of it this way. Let's say you put an elephant and some mice in one room, and you say, okay, fellas, compete. What do you think will happen? Pretty soon there are no mice left. They're all squashed. And you've got a big elephant left, and that's your only choice. We have an example of that in the current Medicaid program, which is one of the worst government programs imaginable. 60 million Americans are stuffed in it, primarily because they're low income or disabled. It's run jointly by the federal government and by the state government. Every governor, and this has been true for 25 years, from the time I was governor, have struggled with finding money to both fund the state share of it and still have money for higher education and for the other state needs. It's filled with waste. The Congressional Budget Office says that 1 out of every 10 taxpayer dollars that are spent for Medicaid is fraud, waste, or abuse. That's $32 billion a year. That's $320 billion over 10 years, enough to make a real dent in whatever we decide to do on health care. Yet, the Democratic proposals that we're seeing involve putting more people into that government program. The problem for the taxpayer is how expensive that is. I've got a letter from the Congressional Budget Office dated July 7th to Senator Gregg, the ranking member of the Budget Committee, which I ask unanimous consent to place in the record.
Without objection, so ordered.
It's from the Douglas W. Elmendorf, the director of the Office of Budget, with whom I'm about to meet, along with other members of the Health and Education Committee. And it says the proposal envisions that Medicaid, that's the Democratic proposal, would be expanded to cover individuals and families with income below 115% of the federal poverty level. That sounds good, but the draft legislation doesn't include provisions to accomplish the goal. About 3/4 of the people who would remain uninsured under this version of the legislation would have income. In other words, even though we're spending trillions more under the proposal, a lot of people are uninsured, and 3/4 of them are going to be dumped into Medicaid. Now, for the federal government, that's hundreds of billions of new dollars that we'd have to borrow. And the thought is that over time it would be shifted to the states. And in the state of Tennessee, based upon conversations we've had with the state Medicaid director, it might add an amount of money to the state's annual budget that would be equal to the amount that a new 10% state income tax would take. Now, if it That's not even the worst thing about it. The worst thing about it is what it would do to the low-income Americans who are stuffed into the proposal. 40% of doctors won't see Medicaid patients for all their services. 40% of doctors. So if we say, congratulations, we're going to run up the federal debt and add a big state tax in order to stuff you into a proposal where 40% of the doctors today won't see you, it's like giving you a ticket to a bus system that doesn't have any buses. Now, what's the alternative to that? The Republican proposals are completely different. They focus first on the 250 million of us who already have health insurance to try to make sure that it's affordable to us, that we can afford it. And then we say, let's take the money that's available and give it to the low-income Americans and let them choose a private health insurance policy more like the policies most of us have, instead of stuffing them into the Medicaid proposals, which are filled with inefficiencies, can't be managed, and which many doctors won't work with. That's a better course forward. But unfortunately, our voices aren't being heard on that subject. But we're going to continue to make our case. We've got the Burr proposal, the Gregg proposal, the Coburn proposal, the Wyden-Bennett proposal. All are different than the government option, and all don't run up the debt. In fact, the Wyden-Bennett proposal, which is really the only bipartisan proposal before this body today, with several Republican senators and several Democratic senators, adds zero to the debt, according to the Congressional Budget Office. Now, maybe as we go through, if we were seriously considering it, we would find a need to add some cost. But at least we start with the idea that instead of adding $1, $2, or $3 trillion over the next 10 years to the federal deficit and dumping a new program on the states after a few years, which the states in their bankrupt condition in some cases can't afford, at least we'd start out with an increased deficit of zero. We're almost working at the wrong end here. Our biggest problem facing the country is the cost of health insurance to every American, not just the uninsured Americans, but the 250 million who already have insurance. And the other big issue is the cost of government caused by the rising health care costs. And we've gotten away from thinking of ways to bring that under control. There are even proposals floating around to take savings to cut Medicare and Medicaid and use those dollars to help pay for the Democratic plans. Mr. President, if we reduce the growth of spending in Medicare, we should spend it on Medicare, which is increasing at a rate that's going to cause our children and our grandchildren never to be able to pay off the national debt. So Republicans stand ready to work with Democrats to produce health reform this year, despite the majority leader's quote that it's time for Senator Baucus to stop chasing Republican votes. We're glad he's chasing Republican votes, and we hope he gets some. But the way we do that around here usually is a group of 15 or 20 senators, like Senator McCain and others, sit around and say, okay, let's put our ideas together and come up with a consensus bill, not operate from the procedure that, well, we won the election, we've got 60 votes, we'll write the bill. It's more complicated than that. It needs a broad base of support in the Senate to have a broad base of support in the country, and without that broad base of support, it won't be successful. We've made our proposals: the Burr proposal, the Gregg proposal, the Coburn proposal, the Wyden-Bennett proposal. We're prepared to start with every single one of those. Senator Hatch and Senator Cornyn have a slightly different idea that would give the money to the governors and let them find a way to cover low-income individuals. I thank the chair. As a former governor, I like that idea. We have an imaginative Democratic governor in Tennessee who has brought the Medicaid program there under some control and has come up with several innovative ideas. The difficulty he and other governors have is that it takes them a year to get permission from Washington to try their innovative ideas to offer the kind of health care to low-income individuals that they might need, which could be different in Tennessee and different in California. So, Mr. President, this is the biggest issue before our country today. It is certainly the biggest issue before Congress. Republicans have our proposals on the table. We're ready to go to work. We want to make sure there are no pre-existing conditions that are left out that disqualify people. We want to make sure that everyone is covered and that we have access to health care at a price, a cost that the family budget can afford. And we are resolute in our determination not to add trillions more to the national debt and not to dump new debt on the states. And we're resolute in our determination not to dump low-income people into a failing government program called Medicaid, when a much better alternative, as we have presented, is to give them the credits and give them the vouchers and give them the cash so that they can purchase private health insurance and have coverage more like the rest of Americans have. I thank the President. I yield the floor.